Hey everybody, hope you all had a good week. So today I am going to be talking about TBIs and hearing loss, the correlation between TBIs and hearing loss. So first off, I'm just going to go through what a TBI is. It's a traumatic brain injury. It usually occurs as a result of a violent blow or jolt to the head or the body. However, it can also occur when objects perforate brain tissue. These can be objects such as bullets, shattered pieces of the skull, um, and injury to the base of the skull specifically can impact the cranial nerves, which is kind of where we see our issues. So the impact here can cause paralysis of facial muscles, loss of taste or smell, loss of vision, swallowing problems, dizziness, ringing in the ears, and hearing loss, which is what we're going to focus on. This is just kind of a brief list right here of the different um, causes, or sorry, the different results from TBIs, but those are the most common. So I wanted to look at signs and symptoms of TBI specifically in the auditory and vestibular systems. Um, so some patients will experience dizziness, vertigo, oral fullness, loss of balance, ear aches, distorted hearing, hearing impairments, noise sensitivity. That's a big one. And auditory manifestations. The auditory manifestations is something that is still being heavily researched. Um, they it is often misdiagnosed with um, like mental health disorders like anxiety, depression. Um, but some auditory manifestations that we would see with TBI patients might be peripheral or central auditory disorders, tinnitus, and hyperacusis, which hyperacusis is like a heightened sensitivity to noise. And then the etiology and pathology. So injury can cause concurrent damage to the auditory pathway. It can occur at any point within the auditory pathway, all the way from the outer ear to the cortex. The trauma can produce conductive and sensorineural hearing loss, central auditory processing deficits, vestibular impairments, and tinnitus. And then there are a bunch of different sites of lesion depending on where the trauma impacts, but the most common, and they are most common because they are most often in the direct line of the trauma. So these would include the TM, which can be perforated. The middle ear is often in line with the trauma, and this can cause ossicular discontinuity, the cochlea, and degeneration of the organ of Corti, and the ischemia of the eighth cranial nerve. And so I couldn't find a whole bunch of statistics specifically related to hearing loss from TBIs. I mean, there were more statistics on TBIs as a general broad, but I was trying to focus it on patients who experience hearing loss from TBIs. So the population that we are most often going to see coming in with this are individuals 75 years and older, and that is because TBIs are super common with the older population due to falls and the likelihood of these individuals falling. And then some other common affected populations are members of the military, athletes, and infants. So infants, we know infants' skulls are much softer than an adult skull, and so they're kind of just more I don't want to say prone to, but like they're more sensitive to head injuries. And specifically, like if they do get a head injury, they're more likely to have like more issues with it than an adult, because their skulls are much softer and aren't as durable. And then this one was an interesting fact I found. Um, Patients who do have hearing loss from TBIs, the most common change in their hearing is between 10 to 15 dB. Um, and TBI is actually the leading cause of acquired long-term disability during childhood. And children with a history of TBI are 2.67 times more likely to have concurrent hearing complaints. And then diagnosis. So it can be really difficult to diagnose hearing loss from TBIs, especially for mild TBI cases. I mean, these symptoms are super subjective, and so it really just depends on the patient's complaint. And um, a lot of these complaints can actually be like they are overlapped with other disorders, and so it's super common for this, unfortunately, to be misdiagnosed. Um, and then focal neurological signs are often mild or transient, so those don't really give us a lot of information. The imaging is usually negative. So because of all of this, what I was reading is that the focus should not be on diagnosing a patient with this. It shouldn't be like the most important thing. It's more um, focused on treating the persistent symptoms and kind of testing out what is improving the patient's symptoms, what's like, making them worse or not helping. And then that can kind of help lead or like point in the direction of the diagnosis. But it's not super important to diagnose TBIs from hearing loss. But there are some tests that can be performed to kind of test for TBIs if the patient is experiencing hearing loss. These tests can kind of guide in the direction of what the hearing loss might be caused from. And these are specifically different hearing characteristics that would be more affected by a traumatic brain injury. So these are sound localization and lateralization, auditory discrimination, and auditory pattern recognition. But I mean, like we know, looking at these tests can be used to kind of like these tests are often used for many other different types of hearing loss, and so it's not super like specified to TBIs, but it can help. And I saw a lot of um, or I was reading a lot of articles that said these tests are kind of used when they are diagnosing these types of patients. It's the treatment and management. Treatment is heavily dependent on the patient's symptoms and the cause and like the point of impact where they're having their issues. So, for example, a ruptured TM, that's not going to require a lot of treatment. They most often will recover, rebuild on their own. Damage to the ossicles can be repaired or replaced surgically. Dizziness for minor syndrome caused by a TBI could be treated with medication. Hearing loss and tinnitus can be treated with hearing aids. But yeah, there's not really like one geared treatment plan. It's super dependent on the patient's complaints and the symptoms that they are experiencing from their TBI. And then I have a quick video here. This kind of it's focused more on the population of individuals in the military, and there's not like a whole ton of research surrounding TBIs and hearing loss. And this individual, we'll see him talk in a second, but he was focusing on like we can identify a traumatic brain injury, and we can identify years, weeks, months later, long term or like more permanent complications from the TBI. But he's kind of looking at how we can help test in between, because a lot of patients, they don't report having complications until a pretty long period after the traumatic brain injury. A lot of symptoms don't appear until weeks or months later. And so he is kind of talking about the importance of, getting tested pretty soon after. But yeah, we'll listen to him. Okay, wait, I actually don't know if you can see this page or not. I'm hoping we can see this.
Blast is a shock wave that travels through the air supersonically. Most people are familiar with it in the case of a supersonic jet, that big sonic boom that they hear. But it also occurs after explosions and can travel out far away from the typical fireball that you see. You could just be standing there and kind of feel like a pressure pulse and feel a little shaken up, but fine. The focus of my work has been trying to understand brain injuries from explosions in the military setting. And what we know from the human experience is that people who do go through explosive events, they're predisposed to later development of neurodegenerative diseases like Alzheimer's and Parkinson's, or mental health abnormalities like anxiety and depression. But we don't really know what's happening between the explosion and those things, which can appear weeks to years later. So some of the work that I've been trying to do is using laboratory research to figure out some of the early stage events that happen between the injury itself and then the later big problems that really can impact people's lives.
So this system will be good not only to detect auditory system in the brain damages, but also perhaps also give some kind of a window look into the brain to see possibly other parts of the brain also damaged. So then we'll have a early stage detection. Then you can tell these soldiers to maybe get on some kind of treatment early enough to prevent later unnecessary, more serious damages.
The goal for us is to take a look at, say, a high-risk population like a military unit who is combat deployed or going through training exercises that have explosions involved, and then implementing simple, easy-to-use screening profiles using easy, non-invasive tests that could, even though they might not have symptoms to report or things that can be identified by a physician, there's a test that could pick that up and say, hey, you're at risk. You might not know it, but we should be looking out and trying to make some interventions.
Yeah, I just thought that was kind of cool because it's kind of focused on, one population that is high risk, and kind of the prevention and the kind of steps that can be taken to help these individuals not really have as harsh, I guess, of long-term symptoms. So 1 second. Where? Hold on. Sorry. I seem to have lost. I'm so sorry, everybody. Okay, here we go. Yeah, here's my list of references. But I hope you all have a great week, and hopefully this was pretty okay to understand. Okay, bye guys.